Kluger from Bevan Britain, Raina Samuelson from Aging Care, Anna Severide from Social Care Future, Jackie White from Care UK, and Lindsay Appleby Flynn from Sarah Care. Thank you very much for your time. And like I say, we are going to be discussing the when. So when things go wrong, when things go right, when people get burnt out, what can we do to support the workforce? Because Professional Care Workers Week is all about the workforce, and how we can really help care workers be able to deliver great care that they want to deliver. So first of all, let's talk about things going right. Let's start on the positive. So you have your teams, or you work with care providers who have their teams. And how do you show recognition? How do you acknowledge hard work that people do? What do you find works best, or what maybe hasn't worked a little bit? And the more practical tips you can share, that would be great. So could I please start with Raina?
Hi, Carolina. Thank you. Yeah, let's talk about positives. So I think for us, it's that constant overhaul of what is working, as you say, and reflecting on what's working. So after through COVID, obviously there was such a lot that affected our workforce in so many ways, and the kind of patterns of work was changing as well. So we did a whole refresh of our leadership and people program. So I think at a time when social care is stretched and funds are stretched and people are stretched with time and managing critical things, it's kind of making sure you put that time aside to recognize when things go right. So for us, it was so learning and development, making sure that we've got things like long service awards, recognizing commitment to a role or to the organization, or even recognizing when people have transferred in from other providers to work with us, but actually they've been in that role or that place for years before. So it's great that they're still with us, but actually recognizing their contribution to what we do, to the difference they make to lives, and then their previous kind of work history as well. Employee of the Month, recognition through awards. I think communication. So we really stepped up our communication through the pandemic. And I think what we found was that connection around communicating. So all these little pieces of good news stories that come across every single day, that if there's a good news story in our organization, it's because someone has done something great. And so it's collecting those, talking about them, celebrating them, and then sharing them and saying, look what difference people make, look what is going well, look at all these things. People talk about what's going badly, but actually all these things are just fantastic, and these are the ways that you enrich people's lives in what you do and that you can support, and that equally where they feel enriched by what they do. So they're learning from the people who draw on our services, they're having just having a great time. So I think sharing letters, emails, to me, it doesn't matter what you use, whether you use social media, whether you drop someone an email. So if I hear of something good, if I see something nice in a report, if I see sight of compliments, it might just be a quick email pinging off, said, God, well done, or I've heard, or someone said you did something really good and you really, dealt with the situation really bad. So I think it can be just embedding that into everyday practice. I think you can have the big shiny awards and they get really well received. You can have the Employee of the Month, you can have the long service, and they're brilliant and really, really important. Recognizing when people get a qualification or a promotion or something. But actually, I think it's embedding that into everyday life and everyday work, and just saying, well done, you'll be great, you rock, and what you're doing is great, and what you're doing makes a difference, and this is why we're here, and isn't it great that we've got that? So for me, it's every little opportunity, whether it's verbal, written, media, whatever.
Thank you, Raina. And Anna, if I could ask you, in terms of employing personal assistants and your own experience, how do you deal with recognizing achievements or great support?
Yeah, thanks, Carolina. So yeah, it's quite different for me, obviously, as an individual that employs personal assistants in my home. And I have been really fortunate over the years to have had a few really fantastic personal assistants that stayed with me for a long time and really got the job, and in different ways, we became good friends as well as employee and employer. But there is always that kind of remembering that they are an employee, and it's a strange kind of relationship that I think is different with everyone that every personal assistant that I've had. And I guess that's my first thing, is that actually it's acknowledging, like I say, I want to be treated like an individual by people that work in social care. Actually, each of my personal assistants is different, and they have a different personality. They might have different ways that they like to work. And so, although, yes, they come in and they're sort of learning my ways of doing things, there's also me trying to make sure that I'm meeting them where they are and what will make their work happier. So I guess it's kind of like it's very strange to start with, almost like sort of a first dates, you know, you're sort of getting to know each other, and then you gradually start to get into that routine. I think one thing that has helped is that I've got better at sort of explaining myself so that they understand more about the role early on, which I think has helped. Another thing for me, I mean, I always try every year to give them a pay rise. It's not always very much, but you know, that's important to me, that they actually, you know, especially at the minute of cost of living, that they can afford to live. And I consistently pay a few pounds over the minimum wage so that it's a reasonable rate that they are living, because I don't want them to be struggling financially. I think there's certain things with being a PA that are probably a bit different. So like sometimes we'll go to the cinema or the theatre, or do some, you know, if I'm doing a craft course or something. So I try to make sure that if I am doing something like that, I'll do it with the personal assistant that has those similar interests. You know, one of my PAs for a while used to be a professional photographer, and I loved photography. So like, you know, we sort of went and did that together. Just saying thank you a lot, I think, is important. And it's interesting because it is my everyday life. So it's, you know, I've had another shower, you know, but actually it's remembering, you know, being grateful for those things and not just taking them for granted. And, you know, if I'm out and about, sometimes just saying, oh, you know, go to a cafe and I'll buy them a coffee and a cake, and just sort of show that sense of like remembering they're a person as well, I think, and not just there to do a job. And that is difficult, because actually sometimes, you know, I'm feeling grumpy first thing in the morning and I'm not particularly, you know, but actually, yeah, I think if you can build that kind of relationship that works both ways, that's really important. I can try and be flexible for them, you know, if they say, oh, it's my child's leaving assembly, can I miss, you know, can I swatch a day or come late or whatever, then I'm fine with that within, you know, a bit of notice. And but equally they will then, for me, sometimes, you know, work at different hours and stuff. So that's when it's worked really well. We've been able to really kind of adjust around each other and meet each other's lives. I think that doesn't always happen, and it can't always work like that. But yeah, when it works well, I think that bit of give and take on both sides is really, really important, and actually really useful for both of us.
Thanks a lot, Anna. Amanda?
Yeah, so I mean, my experience is that with most successful organizations, there is just a simple culture within those organizations that promotes its employees, promotes its healthcare workers, and it's really a top-down thing. I think there has to be a recognition that everybody is human, just as Anna said, and bring that kind of humanity and empathy to our employees. Everybody gets stressed. We get stressed by things in our everyday lives. And I think sometimes there's not that recognition, and we act as if a person has got nothing else on their plate, possibly, than the job that is sitting right in front of them. And I think to have a productive, motivated team player within your organization, you really need to acknowledge that part of their lives as well, the well-being angle of an employee, and give recognition to that. And as Raina said, not just in the form of awards or, you know, employee of the month, you know, a lot of places have those things. And to some extent, it can diminish the value of them as time goes on. So it's really getting to know your employees, again, that human element that Anna went on about. And really that comes from the top down.
Thank you, Amanda. And it's interesting when you say that some things, when they happen over a long time, they may diminish in value because people get used to them. So maybe we also don't make enough of a deal about them because we've done it 100 times. So that's very interesting. Jackie.
Yeah, so I think that everybody said some really important and key things. And I think there's two ways to think about this. For me, it's as a manager and as an individual, and how do you build the kind of relationships that Anna is talking about. And, you know, on that really close one-to-one level, it is about saying thank you, but it is exactly that point about getting to know each individual that you work with and their preferred feedback style. Because for some people, you know, receiving a structured award where they get up in front of the whole team and get a clap and get handed a certificate is heaven, and for others it's absolute hell. So just understanding whether it's praise, acknowledgement, thanks, feedback, what works for each individual and what resonates with their personal values. And then I think as a company, yeah, that is a really good point about award schemes and the keeping them alive and keeping them fresh over time. But I think it's underlying all that is really the culture that you set underneath all of the initiatives, I guess, that you put in place. And that's that culture of really valuing people and having that effective communication to be able to show that you value them. And it might be awards, it might be in investing in them in terms of their career, their learning, their development. The communications piece that Raina mentioned is massive for us. It's a monthly fight to put as many mentions as we can of individuals in care homes into our monthly magazine, because we have so many great stories, and everybody just gets such a buzz out of seeing their name in print and circulated to the company. But unfortunately, we can't put everyone in every month. But yeah, it's that, I think it all comes down to, you know, the leadership in a company and how you structure and think about those recognition programs from the top down and from the bottom up, more to the point.
Thanks a lot, Jackie. And Lindsay?
Well, basically everything that everyone else has already said. But just building on that, and I think one of the points that Jackie mentioned around culture is really important. And I see we have had a question about culture in the Q&A as well. So I think that culture as an organisation and as a sector of celebrating those achievements and celebrating when things go right. One of the things that we hear a lot in the media about social care is when things go wrong, because that's sensationalist and it sells newspapers and it makes headlines. What we don't see is the fantastic job that the hundreds of thousands of professional carers and care workers that we have within health and social care are doing day in, day out. It's a highly skilled workforce. It's not an easy job, and I don't think that should ever be taken for granted. And just having that culture as a workforce and as a sector of celebrating what we do, and that we do an amazing job. Our professional carers do a phenomenal job every single day. And they don't do it for the amazing pay. You know, they're not earning the salaries of doctors, etc. So they do it because they're passionate about what they do. So that culture, I think, is really important, and we really try to celebrate that within SERA. So we have things like SERA Stars and Carers of the Month and those types of things, but where they will be celebrated from the top to the bottom. So our carer can use our communication system that all staff see to tell us about an amazing care visit that they've just done, or their field care supervisor or care coordinator can send a message that all staff will see to say, we've just received this amazing feedback from this service user and just want to thank so-and-so carers or team of carers. And everyone can see that, and everybody can have the option to comment or like, or it's a little bit like an internal Facebook type thing. So people can see that and can comment, and then people can put forward some of those stories to receive awards and recognition and nominations, both locally, regionally and nationally as well. And some of the things that we hear about within that, you know, we've had carers that have had a service user whose home set on fire, and they were able to get that person out of that building and call the fire brigade. And we've had carers where they've performed CPR until the ambulance arrived and that person's life was ultimately saved. And, you know, they're stories that I absolutely love hearing when I get to read those stories, because what a phenomenal achievement and what an amazing thing to do in your day-to-day life. So I think all of that's really important. I think, again, building on what some of the other people have said, is about understanding how people like to receive feedback. So you're absolutely right, Jackie, understanding how best to communicate with different people, with different personalities and different ways of wanting to receive that. That's something that we support our managers to be able to do in a lot of the training that we deliver within Like Lead, Succeed and Well Led, where they learn about those types of things. And things like, sometimes we can get very target driven, and we're all focused on meeting our achievements and our targets. So we constantly talk about, we've not met this yet, we need to do this to meet this target. And we sometimes forget to say, do you know what, thank you, because you're doing an amazing job, and I, as your line manager or whoever, I really appreciate what you're doing. And sometimes that does mean as much as the awards and the prizes, and the nominations and things like that. And then when people are performing really well and things are going really great, give them those opportunities to develop. Give them those learning and development opportunities should they want to be able to progress, so that people can see this sector as a long-term career progression, something that when they do a great job, and not every carer wants to, but the ones that do, when they do a great job, that there is a route through apprenticeships or other training methods of them to be able to go on and develop their career and support other people to pass on their amazing skills and knowledge and expertise that they've gained throughout their career onto other people, and see this sector as a long-term career option and a sector that's worthwhile to work in for the long term. I could probably talk for the next 3 hours on this, but I'm guessing you probably want to move on to the next questions.
Thank you very much, Lindsay. That was very helpful. And I think we discussed career opportunities and development on our previous webinar, and that's a very important point, that when people do well and they want to have certain opportunities for progression, that they are made available to them, and also that they listen to what kind of area they want to develop, and not necessarily what the business is always focused on, because care workers directly working with people sometimes may know better what training they may need as well. Right, now we're going to move on to when things go bad, when something goes wrong, when mistakes are made, because that happens. Even though the media tries to paint care workers as superheroes, which I'm not really on board with, because superheroes don't get paid, and superheroes do things for, for nothing all the time, and that's not who care workers are. Care workers still need to get paid. They need to be recognized for their work. That's why I'm really not very much on board with that superhero narrative, I have to say. So care workers not being superheroes, which means they make mistakes, because they are only human. And I think especially when we have so many vacancies in the sector, and many care workers have to do so much extra work. What do you do, and how do you deal with it, especially thinking about how to deal with it so that one mistake doesn't push the person out, doesn't want to make them leave or quit or feel like a failure? And Amanda, could I start with you, please?
Well, unfortunately, in my work, I only really do come across people when they have made a mistake, or that an error has been made in some way, whether it's an individual error or whether it's some form of systemic error. What I would say to the care workers out there is to take all the help and support that your organisation has to offer. I know it's very difficult when you do make a mistake or you do make an error, to want to hide away yourself, probably, because sometimes you're just very cross at yourself for making that error. I think a lot of care workers blame themselves more than anything when they do make a mistake. So it's very important to take the help and support that your organisation offers, and of course report any errors as soon as they occur, to your line managers or whoever falls within your reporting requirements. Always be open and honest and transparent about any error or mistake that you've made. And if it's within your power to document the circumstances surrounding that error or mistake, then also it's very important that you make a documented note of that as soon as you possibly can. I unfortunately have had instances in the past where people have either been called to a court environment when something has gone wrong, which, you know, it is well outside the comfort zone of most people, and it's a very difficult and stressful environment to be in. Then, of course, there are things like disciplinary proceedings, of course, that can occur. Again, extraordinarily stressful for the employees involved. And I can't stress the importance of documentation by the employees enough, or getting the help that they need and the reporting to the people that they need to report to. One of the instances I find, so for instance, if a death has occurred in an organization of say a resident or something of that nature, the family always is very concerned about, are we actually hearing the truth about what actually happened? And that's why it's so important for the employees to have that openness, have that honesty, have that transparency in their communications then with the organization. Care workers don't enter into their profession to hurt people. What they do is sometimes they do make mistakes. And I think as an employer and as an organization, you have to be very cognizant of that and very cognizant of the stress, the impacted stress that then that happens and on that particular employee. I could talk about court scenarios or HR scenarios for a long time, but I'm not sure that would be helpful. And I'd like to hear actually from the other panel members in terms of how they deal with issues when they do go wrong from their perspectives.
Thank you, Amanda. That was very helpful. And I think the whole point of people don't go into care to hurt others. Those mistakes usually happen because you don't have enough people in the service, or because people are burnt out, overtired, or what we see at the Care Workers Charity. We have care workers going to work hungry or worried about paying their bills. So there's so much on their mind that is difficult or impossible to leave at the door when they go to work. That does impact how they work and what they do. So thank you. That's really, really helpful, Amanda. Anna, obviously in your situation, it's you and your PA, quite difficult one-on-one, he says, she says. How do you deal with it when things go wrong?
Yeah, it's a very tricky situation. Like, I don't have a HR department to refer to. I don't have occupational health. I don't have any of those. I don't even have a manager to go to. So it is, and it's a very intense situation, because I can be with somebody for a few hours that day in my own home. So if the atmosphere changes, you know, if there's tension, that's kind of like in my house, in my life. And that is a really tricky balance. And I know there have been times where I have not challenged or put up with things just because I didn't want to kind of create that atmosphere or have that awkwardness, which I would never have done in my like professional life or other times. But that sense sometimes of just sort of not wanting to make things worse, it's really tricky. And knowing that actually if they leave, I'm then stuck with no care. So sometimes it's like, what do I do here? But I guess for me, there's something around, as personal assistant employers, you know, actually having some better support. It would be brilliant if I could refer my PAs to, say, occupational health. You know, I have had a situation where somebody, you know, was probably struggling with their own mental health quite significantly, and actually that really impacted on their ability to work when they were with me. And actually it was exhausting for me trying to effectively support them, but I had nothing that I could sort of really suggest apart from, you know, maybe to see their GP, you know, and actually that would be really useful. I think I think as well that sense of the effect it can have on me as well as probably on them, but they can go home afterwards, whereas I can't go home. I'm in my home, and you know, I have at times just sort of PA leaves and I'm just in tears because I just can't, you know, I just think, and I dread them coming, and that's a horrible feeling. And you know, you can try and have conversations with people and sort of go down the more formal route. You can try, I've done it in different ways. Sometimes I've tried to be more formal, sometimes I've tried to be more like do it more friendly. I think sometimes that's successful, and actually airing everything, them saying how they feel about things, me saying how I feel, has worked. Sometimes I think inevitably you just end up parting ways because it's just not working for either of you. And that's always really hard, especially at the moment when it's so hard to recruit. But I think actually what I've learned over the years is I probably need to do that sooner rather than kind of keep trying, thinking, oh, it might get better. And yeah, but yeah, it's a very unique situation, and it can be very exhausting at times, especially, and yeah, but when it works well, it's a fantastic system. So
that's very helpful. Like you say, a unique situation when you are at the same time the employer and the person who draws on care, or in one person, and you're dealing with that care work. And I've spoken to councils, for example, in the past around personal budgets, and them saying they're only supposed to be providing the funding, but often they find people getting back in touch with them because there's a little that managerial help or occupational health help would be very useful, but there isn't funding for that around personal budgets, and that is a big problem. And even like you say, recruitment is a problem, and that takes up a lot of your time, doesn't it? Just
yeah, a lot of energy. And people don't, I mean, I'm sure the others have had this as well, like people just don't turn up for interviews or just don't turn up on the first day, which is bad enough, I guess, if you're like a large organization, and that's really tricky to then balance. But if you're an individual waiting for, you know, you just think what is going on. But that's happening more and more, and I think for the whole sector, that's a real challenge, the recruitment side. But yeah.
Thank you. Lindsay, what about from your point of view? What are your tips around when things go wrong?
Well, firstly, focus on prevention rather than cure, I would say. So as an employer, try to do everything that you can to support care workers to ensure that things don't go wrong. So really thorough induction, great training that is specific to the needs of each individual service user and their condition or whatever it may be that we are providing care for. There isn't a generic training package that you can use across the whole of health and social care that will train everybody to do everything. So make sure that you have real good training needs analysis, competency assessments and direct observations that are undertaken frequently, that supervisions happen, all the things to try and prevent that from happening in the first place, first and foremost. And when things do unfortunately go wrong, I think a couple of people have mentioned it already, but most people don't turn up to work to do a really terrible job and to cause harm. So looking at what were the mitigating factors and making sure that we all learn lessons from whatever that was. So if something goes wrong with one of our care workers, what can we do as an organisation to learn from that, to feed that out across all of our other branches, to make sure that hopefully that situation never arises again? Because usually when you investigate and look at these things, there probably were checks and balances and things that with hindsight might have prevented that from happening. So having that culture of continuous learning and not trying to brush things under the carpet and keep it quiet, keep it on the down low, don't let the regulator know, don't let the local authority know, let's try and sweep it under the carpet. Let's have that culture of continuous learning. What went wrong? Let's be accountable for that. Let's look at lessons learned. What can we do to try and identify that sooner in future? What can we do to try and make sure it doesn't happen again? Using things like data and technology to try and help predict things before they may happen, which sounds a little bit pie in the sky, but we've developed software as an example that will predict falls, predict the likelihood of somebody having a fall before it happens. So look at what can we do to remove some of that burden from our care workers of having to spend ages updating care plans and updating notes, so that they can spend their time delivering that hands-on care and hopefully not getting burnt out and not ending up with that compassion fatigue. And training and supervisions and things like that as well are really, really important in that aspect. Don't just send somebody out there and then leave them to sink or swim. It is a highly skilled, stressful job, and you wouldn't expect to see that in a hospital environment. So, you know, the same needs to be the case for social care. Training, regular refreshers, really, really important that we continue to develop our staff. But when it goes wrong, acknowledging it and looking for ways to stop it from happening again.
Thank you, very, very helpful. And I think, again, when you mention training, that's the important part of it, and not tick box exercise training, but training that actually helps people. I think that's important. Thank you. Jackie.
Yeah, I think that part is key, that making sure that people are confident and competent in doing their job. And we always think about that with people coming in new to the role. So we're talking about inductions or buddy systems or training and the like, but there's so much changes in the care sector as well. It's about making sure that everybody's confident with new initiatives that are being introduced, and, you know, with any changes that might be happening in a particular care setting. So that confidence and competence changes over time, and people might need you know, support down the track, even if they've been there 3, 4, 5 years, depending on how the role's evolving. So underpinning all that, fundamentally, I'll come back to culture for every question, because it's about instilling that culture that encourages people to recognise when they need help and be confident enough to ask for it, and know that it's not going to come back on them if they kind of put their hand up and say, look, I'm not sure what I'm doing here, or I feel in danger of making a mistake. And that culture, you know, fundamentally starts right with the people that you're recruiting. So we've moved over the last couple of years very much to values-based recruitment. So we've talked already about how hard it is. I think Anna mentioned how hard it is to recruit people recently. We, as a big care home provider, we're having to recruit people who are new to care, and a lot more people who are new to care. But if they've got the right mindset, values, that desire to really help other people and make people's lives better, then, you know, a lot of the technical side of the things of the role can be trained in. So recruiting against values, making sure we've got the right people to generate the culture that we want, and kind of recognizing that mistakes happen, and, you know, improvement and change and innovation all comes hand in hand with trying new things, getting it wrong, learning, making mistakes. So culture that embraces mistakes as part of that process is really key. And I think actually sometimes we make mistakes with our recruitment, and sometimes we do get, you know, we do recruit people who might not have the right values for the team, or might not be the right fit for the role. And I think it's important to have open and honest conversations where that's the case very early on. Make sure that when you're having those conversations, you're fair, consistent, that everybody coming into a team is clear on expectations and standards. Because I think when you've got a big team, very different to what Anna's talking about again, but when you've got a big team, you know, you need to be fair to the whole team, and make sure that if you've got somebody in there who's not right for that team or not right for that role, that puts undue pressure on a lot of the other members of the team. So yeah, so sometimes people might not be right for the role, but for the most part, as we've all said, people come in with the right intentions. That really caring nature is what it attracts people to our sector. So it's about giving them the support and the confidence to do the role well.
Brilliant, thank you. And that was an interesting thought, saying organizations making mistakes with recruitment, because it's very difficult to know from whatever interview process you have in place. Still, it's not going to be enough to know exactly what the person is going to be like once they actually do the job. So yeah, that was very interesting. Thank you, Jackie. Now, we've all been through COVID. It's still around. It looks like infections rates are on the rise, but when you look back at the worst of it, when we had lockdowns, care workers went through a lot, including not necessarily favorable at times public perception of going around spreading the virus, and that additional mental strain, losing so many people they were supporting. So we have researchers talking about care workers experiencing PTSD. Lindsay, you mentioned compassion fatigue. Somebody else mentioned it on our first webinar today as well. And burnout, I think, is something that a lot of care workers struggle with at the moment. We monitor a lot of online forums. I see both from care workers and care managers a lot of statements around, I love my job, but I just can't mentally do this anymore. It's too much. What have you noticed around burnout? Do you think it's worse now in terms of proportion of the workforce than it was before? Why that is, and most importantly, what can we do to support care workers that are feeling burnt out and to help them actually stay in the jobs that they really love and they want to continue doing? Because that's really it. People talk about recruitment, but it's retention, isn't it, that we need to be focused on. So yes, Lindsay, if I could start with you, please.
Yeah, absolutely. So back to that culture word again, but it's really, really important that we have a culture around supporting staff's mental health and well-being from the top to the bottom and everything in between. So having first aiders for mental health within the business, having a first aid for mental health strategy, and making sure it's something that's literally embedded into the culture and values of your organisation, not something that you're just paying lip service to. So make sure that that support is absolutely there and it's well advertised, and that everybody from the top to the bottom, but particularly the leaders and managers of our services, talk about mental health regularly. Use words like compassion fatigue and burnout, and the fact that we all have mental health in the same way that we all have physical health, and do everything that we can to break down that stigma around talking about mental health, so that people are willing to speak up and say when they're struggling. Often what happens, this is my background, by the way, so I could talk forever about this, you'll have to stop me, is we worry if we're having a mental health issue that we don't talk to our line manager or we don't talk to our colleagues about it, because what happens if I make a mistake, they'll blame it on my mental health, or they'll get rid of me because I've got a mental health problem, because there is still so much stigma, unfortunately, around mental health. And we just need to acknowledge we all have physical health, we all have mental health, and they are absolutely intrinsically interlinked as well. So that needs to be part of the culture of the organisation. And our managers who line manage our direct staff need to have training and support around awareness of mental health as well, so that they understand the signs and symptoms that they're looking out for, to notice those first signs of burnout, to ask people, how are you doing? No, how are you really doing? I'm genuinely interested. I really want to know. I'm asking you because I care about you. And I care about the job that you do, because when someone's struggling with their mental health, as we talked about earlier, chances are that is going to have an impact on their work. So the knock-on effect can potentially be quite catastrophic. I think it's interesting that burnout is now, for the first time ever, mentioned in the DSM and the ICD-11, which is the books that doctors use to diagnose people with certain conditions. Burnout's been around for many, many years, but the fact that it's now in there it's something. Do I think it's getting worse? I think the pandemic has had a huge effect on all of us, And that I'm definitely seeing an increase in the people that I talk to, not necessarily within my organisation, but wider, around PTSD as a result of what care workers went through during the pandemic, because they did endure a lot of the worst of it. But I think it's probably seeming a lot more prevalent as well, because we're getting better at talking about it and we're getting better at recognising it. And I hope that that's one of the reasons, not just that it's all doom and gloom and it's, you know, it's a really terrible area to work in. It's because we're getting better at talking about it. We're getting better at speaking up and reducing that stigma. But when we identify it, looking at what support we can put in place to support those people to remain within the sector, because if we have done it right and we've used values-based recruitment and we've done really great training and we've developed our staff, it would be such a shame to lose them if there's support measures that we can put in place to help them. And that might be looking at what service users they're supporting at that moment in time. Do they need to have a different caseload of service users? Do they need to have flexible working arrangements put in place? There's a whole list of things that we can look at. And again, because I'm from an L&D background, I am going to keep coming back to that. But looking at, again, what bespoke training can we put in place for our staff to support their individual needs? And just one slight example before I stop talking is we have a lot of care workers that haven't always born and bred in the United Kingdom, or haven't always come from certain parts of England. And one of the things that we found some of our staff were struggling with, that was leading to some of this feeling stressed and worried and then having a knock-on effect, was around the culture of care in terms of the service users that they were supporting. So imagine you've got a care worker, they've come from Kenya and they're now working as a carer in England, and somebody asked them for a cup of builder's tea or dippy eggs and soldiers. It's not necessarily the type of thing that we think to train people on, but something like that might cause a lot of stress, because you absolutely have no idea. I wouldn't know what dippy eggs and soldiers was if I wasn't from this country, I think, or even a builder's cup of tea. And the list goes on and on and on. But looking at those different things as well that we can train and develop our staff in, that might be a bit bespoke, might be a bit unique, but giving them that to try and help reduce their stress levels and support them to be able to come to work and do an excellent job. But mental health first aid, so important.
Thank you. And at the Care Workers Charity, we actually offer some funding and support around mental health first aider training, and we get amazing feedback on that. It's a 2-day certificated course. And we also have a program for care workers to self-refer for therapy, which is well used, and we get good feedback, but it's not as well used as we would like, and as we know care workers probably need. And that probably comes around to the stigma around mental health and people worrying about it. Raina, could I now hear from you both on what do you do when things go wrong at Aging Care, but also around the burnout and supporting care workers there, please?
Yeah, I mean, I think what everyone said, I think that all of the three questions kind of lead back to culture, and they lead back to having an open culture, and they lead around whether it's celebration, whether it's reflection on learning, because to me it's about risk sharing. And if we can do those things well, and we can have an open culture where people say things that are good or bad, or when things are going right or wrong, then hopefully you have less people burn out. And I'm always very passionate about that kind of idea of sharing across a system. So for us, very much, I think mental health first aiders, we've done a lot of work on menopause, the impact on physical and mental well-being, on suicide awareness, on so all of those things. I think, yeah, COVID absolutely saw some of those things emerge more within our workforce and create problems. And now we've got, I think that has minimized. I think some people left and felt they needed a bit of time out and came back in. And I think one of the benefits of being a large organisation with quite diverse services is some people kind of went from one role to a different role for a while, and kind of got out of that immediacy of what they'd been through the pandemic and had a change, and then came back to what maybe where their heart originally lie and doing that. So I think the ability to give time out and to recognise that if people need to leave, that you leave on good terms, and then they can come back and they feel welcome to come back, and it's not a failure on their part, that you get permission. But I'm also really passionate about the things now that are emerging, things like cost of living pressures and those things around what's going on in the big wide world that affects everybody's mental well-being and stress, and then what can we as an employer do about it, and what things in the sector may be particularly prevalent and caused by the work that we do. So obviously higher acuity levels of needs that we're dealing with causes pressure, particularly if you're not doing right learning and development and the right support. The way that care is commissioned, if you're in a provider that is largely state funded provision, their commissioning practices place stress on our workforce. So it's about making sure our workforce knows what we're trying to do to alleviate some of that, and that we'll fight their corner. And I think for me, that what do you do when things go wrong? I always want that message that we're risk sharing. We're risk sharing with you. If you've done your best, if you haven't done anything blatantly, gone out maliciously to do something wrong, if you have made a mistake, either just because people make mistakes because we're human, and every human interaction we deliver in care is a separate human interaction with so many things that impact on that moment in time, we will have your back. We will be there with you, and we will look and learn and do all the things that other colleagues on this have said. But also my fight and ask with integrated care systems and with the councils is you risk share with us, because like you were mentioning, Caroline, what I hear from exiting workers is, yes, we can always talk about pay and conditions, but actually it's about, I feel at risk when I go out there, not because maybe anything you're doing as an employer, but because the community nurses don't support me, or the GPs came out and were rude to me, or the family, so this expectation of what care and support workers are doing every day and the pressure. So I always chat in the integrated care systems, share your resources, so share your well-being. You've got much better, stronger occupational health and well-being, so share that across the system and let our workers access it. And some have been really successful at that, because that can enhance what providers could otherwise do within funding structures. But more than that, actually start with that respect and recognition for what our care workforce are doing in your community, and make them feel that they're not alone, make them feel that we recognise that they're doing some work that could go wrong, like anything can go wrong, and that we'll all be there for them, or we'll help share that risk. So for me, I think that messaging again, which comes back like there's other things to culture of openness and letting people know you're fighting for them. And yes, have the mental well-being, have all the training, have that culture that makes people feel more comfortable about addressing, I've noticed you're not as well, all the things Lindsay mentioned about being really proactive in your questioning and really active in your listening, and not having any shame to speaking, and having lots of mechanisms where you recognise that things happen. But yeah, the risk sharing for me is really big in that.
Thank you very much, Raina. That's very helpful. We have 6 minutes left. So Anna, Amanda and Jackie, if we could try and fit in those 6 minutes, please. So Anna, I'll go to you first, please. Around burnout.
Yeah, well, I'll be brief, because obviously I was fortunate during the pandemic that, my PAs were not having to deal with a lot of the situations that have been talked about here, or that would have been sort of traumatic in that sense, because obviously I survived, and yeah, life in one way, well, it was a very odd time for everyone, wasn't it? And it was a challenging time for everyone, but they perhaps were a bit more protected from some of that. But I guess I have had times when I've had PAs who themselves have been going through really difficult things in their lives, and that has obviously impacted then on their work, in a sense, and how they are at work. And it's just been about trying to support them through that, because obviously if they're good PAs, I want them to be able to stay in work and to kind of feel supported. I do think though there's something around PA recognition, so actually I think we're getting a little bit better now at sort of recognizing that care workers are as important as, say, like NHS staff, or like people that work in hospitals, but there are still, for personal assistants, most people still haven't even heard about them, and we can't get things like the card, the blue light card, those sort of things, and actually for PAs to feel like they are part of a bigger thing on some way, I think would be helpful. I don't think they necessarily, I certainly don't think they need to be on a register or anything as formal as that, but actually to have some sort of sense of recognition, to feel like when people talk about the health and care workforce, that they are included in that, because at the moment I think often they're just this like hidden bit of the sector that no one really, well, they're a bit of an afterthought in the situation. So I think, yeah, that'd be good.
Thank you, Anna. Amanda?
Yeah, so I mean, obviously, organisations who employ healthcare workers do look at their staff turnover as well, and I think it's very important that an organisation invests appropriately in its staff. It behooves the organisation to ensure that its employees don't burn out, that they have good wellbeing programs that are in place, that they have access to first aiders for mental health, and also that they have that kind of flexibility that takes into account, again, the human element of the care workers. Everyone, again, has other things on their plate, and you don't know what is going on in someone else's life. And I think it's very important that you recognize that as an employer, as an organization, because at the end of the day, again, it does behoove the organization to keep caring health workers on staff. And if that involves giving them the flexibility they need, or the time off that they need, or the support that they need, then an organisation should think very carefully about that.
Thank you, Amanda. And Jackie?
Oh, this is one I could talk to for hours and hours. So I can't wait for the day when we can have a call and not mention the pandemic. But the reality is, everyone who worked in the care sector at that time is still carrying that experience with us, and will be for a long time. So I think burnout, not everyone burns out in the same way. There's no one size fits all. So there's no one size fits all solution. And it's the visible signs of burnout are really hard to spot. So for some, it's a more obvious. Also build structures that support rest, support people not burning out. Know where your competency begins and ends. So refer to a HR or refer to a GP when you get into a discussion or a situation that feels challenging as a manager, and just, I guess, be kind to yourself. Burnout doesn't happen overnight, so unfortunately you can't fix it overnight either. It's not something you can fix by having a weekend off or a week by the seaside. It's something more structural that people are going to need to step back and have some thought about their own values and their own day-to-day experience.
Brilliant. Thank you very much. And thank you all for sharing your experience and some practical tips for people to, hopefully implement in the work or in the employment of personal assistants, Anna. I think the most important thing is that we try and support care workers as best we can, because as many of you said today, not many people, if anybody, goes into care to do malicious harm. And if people make mistakes or if people do burn out, it's mainly because they care so much or because they have difficulties at home. Thank you so much for those of you who joined and watched and will watch on YouTube once we I've posted it. Thank you to Jackie, Anna, Amanda, Raina, and Lindsay for joining me this afternoon and sharing everything you have shared. I really appreciate it. It was a great session.